My name is Christine Martinez-Vigil. I'm a graduate of the College of Pharmacy from 1992. I currently work for El Centro Family Health in Española, and I am the Director of Pharmacy Services. I'm also a pharmacist clinician. Growing up, I really didn't have a lot of experience in with health careers, or no one in my family was working in the medical field. But my mom was an elementary school teacher, and that's actually what I thought I was going to be doing for my lifetime career. But I had the great opportunity to attend a health careers opportunity program here at UNM the summer before my senior year of high school. And I met lots of other students from around the state. We stayed at the dorms. We were able to hear about different opportunities available in the health career fields. And what stands out for me at that point, and why kind of pharmacy kind of got a little edge, is we had a gentleman who spoke to us about pharmacy and the requirements in college, and said, we take a lot of math and science courses, and I really like math and science. As my son says, I'm a little geeky. And we had a lab that we got to compound a topical product. We made create a prescription label. And so after that, I thought, this seems like a profession that I would enjoy. And so when I registered here at UNM, my freshman year, I declared pharmacy as my major. Well, I am really proud and excited that in 1993, the New Mexico legislature passed the Pharmacist Prescriptive Authority Act, which allowed pharmacists to expand their scope of service clinically. I think this is really a big win for our profession. It also is a big win for the patients that we take care of. I'm also proud when I talk with my patients and we see how they've been able to improve on their healthcare outcomes and they feel better. And to be able to be a part of that is just something that is really meaningful. My biggest professional struggle right now is in relation to the pharmacist clinician, because right now Medicare does not recognize pharmacist clinician as providers. So when we see patients who have Medicare, we are not reimbursed for their services. It's great in New Mexico because Medicaid and other private insurances do recognize us, and we do get reimbursed for the services we provide. So I hope that at some point, federally, that we will see a change and that pharmacists get that status. I like to joke and I say I'm not going to retire till pharmacists are recognized as providers through Medicare, but as I get closer to retirement, I don't know. It's a little bit harder, but I hope that it happens. There are so many different opportunities in the pharmacy field that, you can find different opportunities, and you don't really know what everyone's doing until you kind of see it in action. So I really would encourage people so that they don't have a mindset of what a pharmacist does, because there are different opportunities. And for those students who are in pharmacy school, I would just try to reiterate, I'm sure, what's already being taught to them about really listening to the patient, listening to their concerns, listening to what the patient's goals are, and accepting the fact that sometimes they may not actually align with your goals or national goals, but, really just trying to help support them, encouraging them to make even baby steps along the way. Those will all still make a difference in helping their healthcare. It can be a busy day. It just depends on how many people are on my schedule. I typically see at the end of the day, about 12 to 14 patients a day. And most often I have maybe a little bit more scheduled. So obviously I have some people that don't show to the appointments or they cancel or reschedule. But now that I've expanded my scope of practice and I'm seeing more patients with diabetes and hypertension and asthma, I'm able to have a 30 to 40 minute visit with a patient. Really go over some of the things that they don't get an opportunity to talk to their primary care provider about, or that don't get asked possibly. And so I'm spending that time with them, and then I'm being able to make medication adjustments, order lab work, or doing whatever is necessary for their conditions. I have that time to do that, and then I get to know the patient, and then we schedule a follow-up. And so I go through that throughout the day, and I love what I do. And the best part of my job is really that clinical service. I do have some other administrative duties that I like, but really that's where my heart is there, to help those patients and just to see them want to do better and get better. And so that's kind of end of the day. That's a really good question, because I really had no desire to go back to to where I was, raised in Española. I really, my thought was I came to UNM. I was in Albuquerque. I was in the big city, and that's where I wanted to stay. Well, blessings in disguise, I'll say, because I was able, through various channels, I was able to get this job with a federally qualified health center, and it was in my hometown of Española. And I've been able to help serve former teachers, some of my relatives. And so being able to give back to the community that I was raised really is great. It's amazing how the profession has really changed from when I graduated to where it is right now. And it's a good progression. And so pharmacists now are more considered a part of the healthcare team versus being in a silo on their own, filling prescriptions. And so it's been really great to see that transformation happen. And I hope we continue to see that through insurances hoping to recognize us for our service. But that transformation or the evolution of pharmacists in our careers has been great. I've been a member of the New Mexico Society of Health System Pharmacists, and I'm currently, this is fairly recently, on the legislative committee. So we've met and hopefully encouraging some passage of bills that will help support our profession.